For you.
This week in the U.S., a vaccine that could stop the spread of the Ebola virus. It will be injected into healthy people in the very first stage of human trials. Amid the warnings from the World Health Organization that the current outbreak could spread to 10 more countries, one pharmaceutical company is fast-tracking a potential vaccine. And so far, the drug from GlaxoSmithKline has proven safe in animal testing. Joining us now is Dr. Amy Edwards, infectious disease specialist at University Hospital's Case Medical Center in Cleveland. Doctor, thanks for being here. So this trial will involve 20 healthy adults. They'll get a shot in the arm to see first if that vaccine is safe, and then second, if in fact it would protect against Ebola. And how promising do you think this vaccine in animal testing has been?
So far, the vaccine looks really good, and I think we're very hopeful that it will be effective. Unfortunately, there have been many vaccines that look promising in animal trials that don't pay out when we come to human trials, but this is, you know, we've got to just keep trying until we find the one that works. With
this specific drug, do you believe it to have a better chance of doing well in this human trial?
I mean, it's really hard to predict at this point. Everything looks very promising, and so I think we can all keep our fingers crossed. Right. But while the vaccine may prove to be effective or prove not to be effective, it really is going to come down to basic public health when we talk about stopping this outbreak. I think that waiting for the vaccine would be silly. There's a lot that we could do in the meantime to really help stop this outbreak.
Dr. Edwards, in this vaccine, what makes it look promising, though, specifically?
I mean, when you look at the animal trials, you see good antibody response to challenge with the vaccine. And that's what you're looking for. You're looking for protective antibodies. You're looking for the body's immune system to fight the actual virus. And so when you look at the animal trials of this vaccine, you do see good immune stimulation. And so that, I mean, that's very promising. But animals are not humans, and so we're going to have to wait and see what the antibody response is in these first trials.
So 1,500 people have already died in West Africa in this current outbreak. The World Health Organization predicting 20,000 could ultimately be infected. When you look at this realistically, how fast can this drug be approved and then dispersed?
I would think that the vaccine is going to take several months before we could even talk about beginning production, which is why, you know, we need to take the steps that we can take in the meantime to try to stop the outbreak.
And who should get this first?
Well, if it's proven to be safe and it's proven to be effective, then you have to get it out to the healthcare workers who are being so constantly exposed and who are losing their lives in trying to take care of these patients. And then you have to roll it out to the surrounding community.
So valiant. Dr. Amy Edwards, thank you so much.
No problem.
On this Labor Day, an interesting book just out in paperback details some serious policy changes that could challenge income inequality among American